A gout attack can occur after rapid weight loss with Wegovy or Zepbound. Gout develops when uric acid builds up in the blood and forms crystals inside a joint, causing sudden pain, redness, and swelling. However, the injection itself is rarely the only cause. Rapid fat loss, dehydration, and eating too little can temporarily raise uric acid levels or make it harder for the kidneys to remove uric acid. The safest response is not to stop treatment without guidance. It is to determine whether the attack was triggered by the weight loss process, another risk factor, or a joint infection. Wegovy contains semaglutide and Zepbound contains Tirzepatide. Both reduce appetite and slow digestion. When intake drops sharply, the body burns fat and may produce ketones, acids from fat burning. These acids can compete with uric acid for removal by the kidneys. Uric acid can rise, and that shift can disturb crystal deposits and trigger inflammation. Dehydration can strengthen that effect. Vomiting, diarrhea, low fluid intake, or fasting reduces fluid reaching the kidneys. Uric acid concentrates, and the kidneys may remove less. Existing joint crystals may then shift from silent buildup to sudden inflammation. This mechanism does not make gout a common direct side effect of Wegovy or Zepbound. It does not mean these drugs permanently raise uric acid. Over time, weight loss can improve blood sugar control and help the kidneys remove uric acid. Early and later effects can move in opposite directions. A flare after starting treatment does not prove the drug caused it. Timing can suggest a connection, but it cannot identify the cause. Review changes around the flare: weight loss speed, fluids, diet, kidney function, alcohol, or another medicine. To identify gout, look for rapid, intense pain in one joint, often the big toe, ankle, or knee. The skin may look red, shiny, and swollen. Even a bed sheet can feel unbearable. These signs come from the immune system attacking needle-shaped uric acid crystals, not from the crystals cutting the joint like glass. However, a hot swollen joint is not automatically gout. A joint infection can look similar and damage the joint quickly. A first-ever attack needs proper assessment, especially with fever, chills, a wound, recent surgery, a weakened immune system, or a replaced joint. Guessing from a photograph is not enough. Once infection is excluded, rapid loss is riskiest in someone already prone to gout. Previous gout, high uric acid, kidney disease, water pill use, heavy alcohol intake, and a strong family history all matter. The injection may be new, but crystals may have formed before treatment. Food changes can add another layer. Some people start Wegovy or Zepbound, then combine it with fasting, a very low carbohydrate diet, meat-heavy meals, and almost no water. This is not stronger treatment. It stacks several gout triggers together, so blaming the injection alone misses the full picture. Forcing faster loss can trigger a flare, even when the long-term goal is healthy. Severe appetite suppression is not proof that the dose is perfect. Repeated vomiting, skipped fluids, and days of minimal intake are warning signs. Faster loss may cause pain, dehydration, and treatment interruption next week. Another mistake is blaming every flare on rapid loss. A beer-heavy weekend, dehydration during travel, a new water pill, kidney decline, or stopping allopurinol can trigger the same attack. Allopurinol is a daily medicine that lowers uric acid. Weight loss may be unrelated, so review every recent change. After finding the trigger, treatment aims to stop inflammation quickly. Doctors commonly choose an anti-inflammatory medicine, colchicine, or a steroid medicine. Colchicine is a gout drug that blocks inflammation. The best option depends on kidney function, ulcers, blood thinners, infection risk, and other medicines. Leftover tablets can turn joint pain into a second medical problem. Do not automatically stop allopurinol or febuxostat during a flare. Febuxostat is another daily medicine that lowers uric acid. These medicines work over time and are not instant painkillers. Stopping them can raise uric acid and increase future flare risk. Changing a stable preventive plan without medical guidance usually works against long-term control. A separate decision is whether Wegovy or Zepbound should continue. A treatable flare while you can drink normally is different from vomiting, dehydration, or worsening kidney function. The second situation may require delaying a dose, raising it more slowly, or changing treatment. The choice depends on whether you have joint pain alone, dehydration, or worsening kidney function. Accurate testing matters because one blood test can mislead during the attack. Serum urate means the amount of uric acid circulating in blood. It may be normal while crystals still cause gout, so a normal result during pain cannot erase the diagnosis. Rechecking after the flare and reviewing older results gives a more useful picture. The injection date alone cannot identify the cause. Look at 4 things together: previous gout, recent weight loss speed, dehydration or severe food restriction, and kidney function. Then ask whether another trigger appeared. This separates a temporary weight loss flare from uncontrolled gout, a medicine-related problem, or a joint infection. Weight loss speed has no single magic cutoff for gout. A 10-pound loss can be gradual for one person and abrupt for another. The warning is rapid loss with poor intake, ketones, vomiting, or weakness. The body reacts to rapid fat burning, poor intake, and fluid loss, not an impressive number online. When that pattern still does not identify the cause, joint fluid testing becomes important. A clinician removes a sample from the swollen joint. The laboratory looks for uric acid crystals and bacteria. Finding crystals supports gout, but infection can exist beside crystals. A laboratory culture checks whether bacteria grow from the sample. Once infection is excluded and gout is likely, prevention starts by reducing avoidable triggers without sabotaging weight treatment. Drink regularly unless heart or kidney disease requires a fluid limit. Avoid crash fasting during dose increases. Use smaller balanced meals instead of starvation and heavy meat meals, aiming for steady loss with enough fluid and nutrition. Alcohol and sweet drinks deserve attention. Beer and spirits can raise gout risk, while drinks loaded with fructose, a type of sugar, increase uric acid production. Cutting those sources helps without turning every healthy food into an enemy. Vegetables, beans, and moderate protein usually matter less than dehydration, alcohol excess, and repeated crash dieting. People with recurrent gout need prevention based on uric acid, not pain alone. Many guidelines use a blood uric acid target below 6 milligrams per deciliter. That target means crystals are less likely to keep accumulating. Reaching it often requires regular testing and dose adjustment, even when the joints feel completely normal. Uric acid treatment is only half of prevention. The weight loss plan matters, so dose increases should pause when side effects make eating or drinking hard. If each increase causes vomiting, near zero intake, or rapid weakness, report it before the next dose. A tolerated dose can work better than a higher dose causing dehydration, flares, and missed injections. Alongside dose changes, warning signs need faster action. Seek urgent care for fever, spreading redness, severe illness, confusion, inability to drink, or very low urine output. Seek care for a first hot swollen joint with infection risk. Get prompt medical help when pain is uncontrolled or several joints become involved. Rapid weight loss on Wegovy or Zepbound can help trigger gout, especially with dehydration, fasting, kidney disease, or previous high uric acid. Yet the treatment may lower long-term gout risk as weight and uric acid improve. Protect the kidneys, treat the flare, review the timeline, and keep weight loss steady rather than extreme. Medicine simplified, that's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.